Thank you. Let me start with a story. A 39-year-old South African mom was experiencing persistent cough. She at first didn't know what to do about it, but she then remembered that she was getting WhatsApp messages during her pregnancy from Mom Connect. And they recently just had shared that they also integrate a symptom checker that she can use to assess her symptoms. So she does. And it tells her to seek care immediately. And when she does, she gets diagnosed with tuberculosis and put on treatment right away. This is just one of many stories that I can tell you about someone using a symptom assessment as part of Mom Connect, which is South Africa's government-led maternal health platform, organized by the local organization Reach Digital Health. They send stage-based WhatsApp messages to pregnant women and young mothers in South Africa to support them on their journey. And we integrated a symptom assessment because they got so many messages about people asking about their symptoms that they wanted to provide personalized guidance for their users. And we then ran a decentralized clinical trial to understand the effect of the advice on user behavior. And the data told a really powerful story. From the nearly 1,000 participants, nearly 50% changed their behavior after seeing the advice. Initially, only 17% of users wanted to seek care. That went up to 43%. And this is not just more people seeking care, it's actually the right people seeking care. We sent those cases to a local physician panel, and they assessed that not only safety increases, which one would assume, but actually the behavior was much more appropriate. And what I personally found really interesting was that half of those who received treatment thought they could manage their symptoms at home on their own. And if you look at those cases individually, you really see the impact, because these are patients newly diagnosed with meningitis, threatening miscarriages, sexually transmitted diseases, vitamin deficiencies, and a lot of women diagnosed with hypertension during pregnancy. And early identification is crucial so that complications don't exist. So we learned a lot of lessons throughout this collaboration. And I used the social media format, just keep or toss. And one thing we learned that we should keep is to integrate into familiar low data platforms like messenger services. Data can be really expensive in many regions in the world. And even if an application is for free, it is still out of reach for many people. But if you integrate into services that people already use, that they're familiar with using, and that don't cost much data, it's going to be much easier for people to access it. Another one is to continuously adapt and test for local relevance. Many medical devices are initially designed for a very different context. But if you want to provide value in low resource settings, it has to be easy to navigate. It has to be locally relevant information that you share. It has to be available in the local languages and also for the right health literacy level. Large language models are great to assist with this if you combine it with continuous user testing and local input. Okay, so what to toss? Toss the idea of building standalone applications or programs. It is really hard to scale if you have no existing user base in the country. But what really works is if you partner with a program that is already scaled and you solve a problem together. You just skip the uphill climb and just build on what's already working. And the last one is don't skip early engagement with stakeholders. Trust in healthcare is so important, especially if you want to change people's behavior. And we conducted phone interviews with users in South Africa, and they said they trusted information most when it came from the governments or the healthcare providers. It doesn't only have to be about integrating into their service, but it's also a lot about recommendation by them. All right, that is already everything from me. I want to thank the partners at Reach Digital Health, the National Department of Health in South Africa, and my colleagues at Ada Health. If you have any questions, you can find Carol and myself if you want to exchange some learnings. If you're interested in integrating symptom assessments into your organization, also please come and reach out.